Okay, we'll get started. My name is Richard Hahn. I'm a senior policy associate at the Niskanen Center, a nonprofit, nonpartisan think tank based in Washington, D.C. that works to bring evidence to policymakers. I'm very fortunate to be joined today by the two people who've probably taught me most about causal research. Sarah Tahamont, an associate professor at the University of Maryland in the Criminology and Criminal Justice Department, and Greg Midgette, a senior policy researcher at the RAND Corporation and also an associate professor at the University of Maryland, also in the Criminology and Criminal Justice Department. Today, we're going to be talking about how to sort through evidence for policymaking, what kind of evidence policymakers use, and how research can affect the policymaking process. So I think the place to kick this conversation off, really, and it's a broad question, I apologize for that, but when people talk about evidence-based policy, we've heard a lot about evidence-based policy in the last 10, 15 years. What do they mean? I defer to either of you who wants to answer that first.
Go ahead, Greg. Kick us
Yeah,
off.
I'm sure. So, and thanks, Richard, and thank you to the center for having us. I'm excited.
Oh, sorry. One thing,
Yeah.
I was deficient in my moderating duties. I meant to say, if anybody wants to ask questions, feel free to put them in the chat throughout. Don't feel like you have to wait till the end, and I will read them as they come in. Sorry, Greg. Go ahead.
Yeah. So, let's think in terms of the evolution of evidence. I think initially, before we had much computing power, we would think about evidence-based practices for any social policy, but especially in criminal justice, in terms of what logically should work. What are the things that would be effective? And then some limited data analysis to support that stuff would occur. But with the advent of computing and statistical software, things became increasingly empirical, where we could measure if we think that recidivism, however defined, would go down. We can do that. We can collect a data set from administrative records, find the averages, look at whether averages change after some policy is implemented. Then in this period of empiricism, we start to think about, well, how do we measure cause and effect cleanly? And one major development in the past 30 years, especially acute in the past 30 years, was the credibility revolution that occurred in applied macroeconomics. So folks like Ingres, Card, and Imbens, who eventually were awarded a Nobel Prize for capturing the properties of an experiment from non-experimental settings. So where we can measure cause and effect based on the idea of a treatment and control group, even though in reality, for many criminal justice policies, that sort of setting wasn't feasible for a bunch of practical or ethical reasons. So with that development, when we think about evidence-based policy, we're moving toward like the concept of stronger internal validity, meaning we're really measuring cause and effect well. Did this policy change the outcomes of interest, in teasing out the potential effects of other stuff that may have been influential? And so one of the things that criminal justice policies relied a lot on was the Maryland report and the Maryland scientific method scale, which was developed as part of that report in 1998. I think it was initially published. And that actually developed that hierarchy of evidence that it's better when we can get something that's really close to cause and effect as we would measure it in an experiment, even when we don't actually truly run an experiment in the field. Of course, that then now being getting up in age in terms of the way that initial scale measured credibility, there's interest in adapting that scale and expanding it to incorporate new methods that have been developed since then. And so when we're thinking about evidence-based policy, we're drawing from studies of what worked in other settings. And the things that we should really be focusing on are the things with the strongest evidence in terms of both internal validity, measuring cause and effect well, but also external validity, which refers to, well, it worked in that place, will it work for me?
Yeah, and I think sort of building on what Greg's saying, I think we can think of evidence-based policy as having sort of like two main meanings, or two main sort of like iterations. The one is the one that we hope is meant by evidence-based policy, which is that strong and credible evidence guides the shaping and development of policy positions, of legislation or regulation, that the features of those policies are based on what we know from the evidence base, right? So that's like that's, I think, all of our ideal scenarios. And then we also see sometimes what happens in practice, which is that often some evidence is either being used or in some instances generated as cover for policy features or policy positions that really are motivated, elsewhere or by other things, but need to have some, cover around them to move forward. And I think that ideally where we sort of want to sit is in that more sort of optimal space, or like create the conditions where evidence that is generated and that is credible is also accessible, right? So I think that's one of the things that was so powerful about the Maryland scale, was that it really was accessible to anybody with any type of background to really be able to understand how to consider the credibility of evidence. But as Greg said, it was really heavily focused on one dimension of credibility, which is internal validity, right?
Okay, so just to pause and focus on one thing for a second, because I feel like there are a lot of people, there's some researchers in the room, but also some people who are consumers of research. And I think, Greg, you mentioned this a little bit, but just to really drill down, there's a lot of kinds of research. Like, people who have jobs like we have do a lot of different kinds of research. Some of it is testing out big criminological theories of like why crime happens, why someone would commit a crime. And some of it is evaluating things that have actually been done by governments to try to prevent crime. So when we talk about hierarchies of evidence and evidentiary scales, what kind of research are those really meant for?
So really the best place where we can think of it practically, and practicality matters a ton here for policy, is intervention research. So if we step back and think about what criminologists traditionally have done, it's broad social theory. Why do we have crime and disorder? What are the things that explain these patterns that we see in crime rates and arrest rates? And that sort of information is really useful for us understanding the way the world works. But for us understanding how to change the world, we care about interventions. And so we're focusing narrowly in the way I'm conceptualizing evidence on not what are the underlying mechanisms that generate crime, but what are the sorts of things that deter or stop crime or encourage desistance that we can implement and watch affect something. And so that's really the focus to me. And I think for policymakers, pragmatically, that's the focus as well. It also means that there are many types of policies that theoretically are possible, that sound really promising in principle, but in reality are non-starters, either because of the practical limitations of a jurisdiction or of the set of actors that have to be working together, or because of political realities, and often because of both. The other thing I'd just like to say is that because policymakers are on some level pragmatic, and because they have some stance about some normative beliefs about how the world should be, which is not an area that policy research covers. We're about how the world works, and how the world can be better potentially given some objective. We want to focus on things where we can create good evidence. Whereas policymakers might default in the absence of evidence to say, well, I'm in jurisdiction X, jurisdiction Y next door is doing this thing. We can do that too, even absent evidence. So often you need to make decisions in the absence of evidence. We would encourage, when you're making those decisions, make them in such a way that allows us to generate evidence about whether that was a good choice or not. But ultimately policy research should act in tandem with policy because we're relatively slow to deliver the information that a policymaker might need to answer a policy problem. But the evidence base we're developing can help inform things, even if it's not directly the thing that you hope to implement. If we've done some things, if we know a lot about things that are similar in principle, it may still help guide the design of better policy.
So Sarah, you used a word that may have gone, a phrase that may have gone over some people's head, internal validity, as sort of like what the Maryland scale was trying to maximize on. And you teach in an entire class that I would argue the point of the class is to maximize internal validity. Would you just explain what a policymaker or a consumer of policy research needs to know about what internal validity is?
Absolutely. So internal validity is ensuring that we are making an apples to apples comparison is the simplest way to put it. Is ensuring that when we're comparing two groups, often referred to as treatment and control, that those two groups are comparable, not just based on their observed characteristics, which usually with administrative data, and many of the data sources that we have access to, we can sort of ensure balance or ensure comparability on the things that we can observe. But also, when things are highly internally valid, those two groups that you're comparing are comparable or balanced on not only their observed characteristics, but also their unobserved and unobservable characteristics. I always distinguish between unobserved and unobservable because there are some things that are observable, but we maybe just don't have data on them. Those are a problem for us when we're thinking about internal validity, but also things that are unobservable, meaning things that are sort of latent or things that are ephemeral or things that, we sort of like conceptually understand them, but they're not something that we can credibly measure, right? Or that we measure with error, and those things very rarely appear in data that's available to us on a large scale. And so some of the techniques that are put forward for causal inference research are those that are going to sort of try and make some assumptions. The weaker, the better. This is one of those instances in which you actually want weakness, not strength. We want weak assumptions that allow us to say, like, if these weak assumptions hold, right, then we can credibly say that any difference in outcomes that we observe between this group that we intervened with or that was intervened with and the group that wasn't, those outcome differences are caused by that intervention. And when we can't wrangle, right, or somehow balance over those unobserved and unobservable differences, then we're worried that what's driving those differences in outcomes might be something that we just didn't capture in our analysis. But importantly, the reason we call that internal validity is it's referencing that internal comparison between the treatment and control groups that are in our analytic sample. And that differs from something we refer to as external validity, which we would all understand as just generalizability. Should we expect this difference in, outside of our sample, right?
So maybe it's useful to when we talk about strong and weak assumptions, maybe it's useful to sort of talk about the way most hierarchies of evidence right now are set up. So most hierarchies of evidence now put an RCT, a randomized control trial, what we call a true experiment, at the top. Why an RCT? Why is that particularly good at maximizing internal validity?
Yeah. So, and I think that I saw a couple of great questions in the Q&A, and maybe in attempting to answer your question, Richard, I can start to touch on these, but we should really give some time to being thoughtful about answering the other Q&A questions. So in RCT, in principle, so one important thing is that in many settings, really settings outside of the social sciences, an RCT is a gold standard because you can draw a diverse pool It's representative of the population of interest. You have a control group, people that don't receive the stimulus, and a treatment group, people that do, who are drawn at random from the population. And so there should be, as Sarah referred to, balance. Those groups should be on, in all the ways that we care about, the same. And then we provide some stimulus, some intervention, and see what happens. That is, in medical research, pretty well easier to do than in social science research. But it is never actually as easy as we really think it is, because when we tried it, the principle is that if we were to replicate the study over and over again, we should find results that are statistically indistinguishable each time we run an experiment. And if we don't, then the experiment has some validity issues, and we might think about how that occurs. When we're doing things in the field, we can run experiments sometimes, field experiments. More often, we're trying to use quasi-experiments, some natural variation that occurs in nature that sets up the conditions of an experiment for some representative portion of the population. When we do that, we're banking on external validity, but we might not have a good sense of whether external validity exists. That's one issue. The other issue is, again, that internal validity. Are we really measuring cause and effect correctly? In a randomized controlled trial, you have two, in principle, identical groups that are representative of the population. There's only one thing that differs, and that's the stimulus, the intervention. In reality, outside of a lab or outside of a very controlled environment, many things might differ. Even, and as Sarah was referring to, the things that we measure about people or about the unit that we're studying, we have lots of measures, but we probably don't have all of them. The more we rely on having all of those measures measured, the stronger, or the more tenuous, which is weird, stronger assumption, more tenuous, but that's what we mean, the estimate would be. The stronger the assumptions we need to make for this to be true, the more tenuous that statement of cause and effect is. And so the hierarchy of evidence that exists, for example, in the Maryland scale, follows that logic. RCTs, really strong internal validity. Field experiments, up there in principle, in terms of internal validity, measuring cause and effect well. As we move down, when we think about something that replicates an experiment in nature, like maybe you have a lottery system that applies, like you don't have enough of this thing to go around. So some people win it and other people don't, and that lottery is random. So you have something that looks like an experiment. And then you can continue to follow that logic. But as you make increasingly strong assumptions about getting back to cause and effect, about getting back to the idea of replicating that experiment, the idea that you have a treatment and a control group falls away, becomes weaker and weaker. It's the group that receives a thing, and then, or we think receives a thing, and a group that doesn't. So a comparison group, it's not a control group. And so the further we get away from experimental conditions in terms of the hierarchy of evidence and the research methods we're providing or we're able to use, the less we should believe cause and effect is true. And so that's the hierarchy of evidence. And we can get into the specifics of what types of research designs are weaker versus stronger in terms of internal validity. But also we should be thinking about external validity, whether the thing that they found would generalize to the broader population or to your population of interest. And that's like the idea of replicability that has a huge issue in two different ways. Internal validity, doing the exact same thing among what should be the same population and finding different results. And then external validity in terms of replication that, well, it worked in North Dakota, is it going to work in Michigan? Well, maybe not. And maybe for reasons that if we were careful about our research, we could understand, or it would work.
A couple of things to add just on that point, Richard, before we move on. At the risk of being sort of overly technical, I think one of the reasons that RCTs and other experiments end up at the top of the hierarchy of evidence is that there is this feature randomness, right? So the thing about randomness that makes it special is that it is unrelated to anything. Like that is literally how randomness is defined, right? It is just it's so hard to avoid the tautology of like being like, well, it's random. That's what makes it random. It's unrelated to anything. What that means is that when we have random assignment to condition, meaning that the thing about the subject that determines whether they get the intervention is pure random chance. It's not related to features of their identity, features of their background, features of their motivation, or anything like that. Now, all that stuff is kind of fixed before we start the process of an RCT. Yes, there are eligibility criteria, and that's going to relate to what we'll talk about when we talk about reproducibility and replicability, because there are always going to be eligibility criteria for social programs and for different things. So, but once the eligibility criteria are met, that pool of people should be comparable in terms of their eligibility. Then whether or not they get the intervention is random chance. What that means is that ultimately, when I was talking about those unobserved and unobservable characteristics, they're unrelated to the chance that someone got the intervention. That's what puts the RCT up at the top of the hierarchy, because we know if there's true random assignment and there's fidelity to that random assignment, we know that the only possible explanation for a difference in the outcomes is the intervention itself. And that's the thing, like that's why it's up at the top, because conditional on fidelity of randomization, right? And then there are a whole lot of technical things about the experiment related to compliance and whether or not people who were intended to get the treatment actually did get the treatment and all this stuff. So there are a lot of, I don't want to oversimplify something that can be quite complicated, but the sort of tagline is that because an intervention is randomly assigned during an RCT, it is unrelated to anything, observed characteristics of the individuals in question and unobserved and unobservable characteristics. And we know that, right? And that's what puts it, I think, at the top of the list. One of the things that is really important, though, is that focusing on internal validity, like at the exclusion of external validity, can be really problematic for policy, because often a policymaker is concerned, okay, well, if this happened in New York, should I expect it to happen the same way in Chicago? And, or if this was an experiment done on adults, should I expect it to have the same effect among adolescents? And these are all like really important questions. And I do think that one of the downsides that we see, and this is kind of based on like misaligned incentives between those who produce evidence and those who need to consume evidence, is that there are very few incentives in academia for replication, right? There have been sort of like some targeted efforts to encourage replication, but in the social sciences, that really hasn't been an incentivized feature of the evidence production function, I would say. And I think that that's a problem if we're concerned with how to make sure that the evidence base is sort of robust for policymakers.
Now, just because that I think it's a really interesting point, and I don't mean to skip over the questions or anything, but so where's the locus of that problem? Is that editors at journals who don't want to publish an article on the same old intervention again, or is that just attention deficit academics who don't want to research the same thing again? Like why are those incentives messed up? Why aren't policymaking and policy research incentives aligned?
So
It's hard to say exactly where it comes from, and I'm sure that Greg has some thoughts on this, but I will say that at least some of the blame has to be placed on the peer review process, on not only editors, but also reviewers sort of pushing for uniqueness, like what is unique about this, and sort of adding that as a criteria that's like implicit rather than explicit in terms of like what we believe should be like the production of knowledge. um and like I said, I don't want to make it out like that's the sole cause, but we have to at least put some responsibility there.
Yeah. And so in that cascades, in the, so journals want clicks, or they want university libraries to buy them, or whatever the business model is. To keep a job in academia, you need to publish in those journals. And so there's a huge incentive for spicy findings. And there is a huge incentive to be unique. There's very little incentive to replicate a study. There have been really, really good things to occur, like the socialization of replication packages for publications, and registering your studies, especially RCTs, so that we know what you're supposed to be doing. And there's record of that and whether it's being carried out. That is a tremendous improvement over what occurred before. But the incentives toward replications just aren't there. And the sense of what constitutes a replication is probably much too broad, where, well, somebody already did that in Chicago, so we know it works. And oftentimes it's somebody already did that in New York or Chicago. But New York and Chicago are unique places, even from one another. And we know almost nothing about what works in rural or suburban areas because nobody studies them. And part of that, even though there's a lot of the population and needs and capacity to develop policy, is different in those areas. So there's a huge replication crisis in a few different ways, both in incentives, and then actually when you go and replicate a study, more often than not, it doesn't pan out, which is crazy, right? That even when replication packages exist for studies, when you push on them a little bit, things might often fall apart, way more often than should exist.
There's also a technical problem, right? And this is something that Greg is raising when talking about like suburban and rural areas, is that oftentimes researchers are very interested in precise estimates. And so they're going to look for something that is sufficiently statistically powered. And that can be a problem when you're working in an area, right, or with a program that's quite small, right? And so that's also sort of a technical incentive to shy away from those settings. But it is still important to think about them and to think about how maybe we can get at some of the questions that we have about how things might replicate or reproduce in those settings. And another sort of technical problem there is that it's often the case that in very large states or very large cities, there's an infrastructure for handling research requests from academics or other outside researchers. There are people who are staffed to help with that. And there's an infrastructure for legal agreements and protecting confidentiality and all this stuff. And in smaller places, there's not necessarily any resources to have someone staffed to do that. And so it makes working in those areas really challenging.
So taken to its logical extreme, the problem with external validity, the problem with replicability, uh, it seems to say, well, every jurisdiction, every agency should pilot what they plan to do before they do it. Obviously, that's infeasible, or I don't know, is that infeasible? I mean, how essentially, it seems clear how we deal with the problem of internal validity. Like we have methods for that and standards for that,
Yeah.
but we don't seem to have methods and standards for the external validity aspect.
So I'm going to answer that, but also stress something else that is against my best interest as a researcher. That like it's when feasible, setting up something to be evaluated and with the idea of like an adaptation phase, like this being ready to appreciate the steep part of the learning curve when you're doing something new and setting up the policy such that it can be changed and maybe sunset, right? If you're writing something into law, it's hard to change law, and there's policy moments when that's feasible, and then most of the time it's not, given some policy domain. So being thoughtful and forward-looking in terms of that, running a program, running a policy, and then potentially understanding that it's going to need to change, it's going to need to adapt, and letting it grow rather than doing something jurisdiction-wide to start with, I think is a practical good idea for smart policymakers, for smart policy making. The other side of it is, and there's a question in the Q&A going down the list about, well, do we really actually know nothing? Because we're talking about very precise internal validity. Do we not, like, if we're not confident that something would apply to other jurisdictions? That is the mindset of a researcher, is that we need to tweak this thing, see if it works. Tweak this thing, see if it works. Does the effect size change when we do this? But for a policymaker, that's annoying, I would imagine. I'm not a policymaker. Rather, there are principles that should guide research that we learn from the evidence base. And what I would aspire to be as a researcher is to convey what are the core elements of good policy. If you're trying to reduce, I study drugs and drug policy, in policies affecting people who use drugs, what are the things that seem to have an evidence base? I'm not going to be able to tell you exactly what you should do in your jurisdiction until I learn a ton about that jurisdiction and learn a lot from the people who work there and live there. But I can tell you, if you're trying to combat the opioid epidemic versus psychostimulants, it's going to look different, because interventions among people who have an opioid use disorder are different than interventions for people who have a psychostimulant use disorder, a methamphetamine use disorder. And people who have polydrug use, it will be different in a whole new way. And so, but for me to say, here is the thing you should do exactly this, unrealistic, but I can give you enough guidance about potential interventions based on what we know so far from the literature that it should be helpful. And then when you do it in such a way that it can be evaluated, not just so that we can generate journal articles, because nobody reads those except for us. Instead, so that you can learn from how things are going in your jurisdiction and you can adapt. And if you don't think about policy in terms of designing it with evaluation in mind, it's not good policy, because you won't know whether it's going well or not. You'll have to rely on anecdotes. And anecdotes are much more powerful when they're delivered by a really compelling voice. And that compelling voice might have motives other than like what's best for long-term policy. So that
or what's best for the social, like the net social benefit, right? Like if that's what the sort of criteria is. But I think I want to sort of try and also respond to this, the question about the risk of saying we know nothing, or we really can't know. And also in combination with this idea of like how uncertainty is communicated to policymakers, because I think that is very, very challenging, right? I think I've noticed that there are incentives even in academia among people who are trained and should know that estimates are just that, and that they are uncertain and they should be taken with a grain of salt, and sort of like communicated with uncertainty, with the built-in uncertainty in mind. And this is why, just as a little, I'll give one of the nuggets that I always say to my students, which is like any estimates that are generated from models that you're running should be communicated using the confidence interval, not using the point estimate. Because when you communicate things only with point estimates, you risk people who are not trained, because why would they be, right? taking away a false sense of precision about what you're actually doing. Like estimates should be communicated as estimates. And one of the easiest ways to do that is to always communicate using the confidence interval and saying, well, we think it's between this and this value. That can be really powerful, because if you have a narrow confidence interval, you are in great shape. And if you have a wide one, it should communicate that, like, we really don't know as much as we would like to about something, to potentially act on it. But related to this idea of like, what's the risk of just saying, well, we don't know anything and we can't know anything? I do think that there are methods and approaches to, making the best of certain situations. And as an example, I will talk about the fact that there are very few people who would tell you that that they're unsure whether smoking causes lung cancer, right? It's like it's taken as fact, smoking causes lung cancer, right? Smoking cigarettes. And apart from a small number of studies that are sort of like rumored to have happened where there was random assignment to cigarette smoking, most of that evidence, most of that understanding or those conclusions come from observational studies. They're not from clinical trials, they're not from RCTs. But the thing that makes it super compelling is that there has been evidence of sort of bounding of the potential bias that's involved in like how large would selection into smoking, how large would the bias, right? The feature that like makes people smoke that might cause cancer that, we don't see, if it's not the cigarettes, and in fact it's something that is true among smokers, how big would that have to be to nullify what we see as the difference between smokers and non-smokers?
To put it in
Right?
concrete, like maybe there's some behavior that smokers have that non-smokers
Exactly.
don't have, like maybe they drink more or something.
Exactly. Maybe there's something else that they're doing, or maybe there's just something else that's like true about their personalities, or maybe there's something, that is this third thing that causes people to smoke and to have lung cancer. We don't know, right? Well, the answer is it would have to be 9 times more likely, 900% more likely in smokers than non-smokers to explain away the outcome differences in cancer, right? And could there be something? Yes. But is it likely that there's this unknown thing? I don't know. Probably not. And that's one of the things that I think, like, there are techniques, there are sort of bounding exercises, and all of this I think comes to, yes, ideally we would have the strongest evidence when we're making decisions about people's lives, but very often we're in a compared to what situation, right? Now the line that I might draw, or Greg might draw, or another, person who is very involved in sort of generating causal research might be in a different place for what I would say, well, this estimate is better than nothing, right? So the line might be drawn in different places, but almost always we're thinking about, well, is this uncertain and potentially not credibly causal estimate better than making the decision with none of this in mind? Because ultimately policymakers are constrained to make decisions whether there's evidence or not.
So the reason why there's no RCTs on smoking is because we consider it unethical to assign someone to be a smoker if we think there's danger in smoking in the first place. And there's a lot of criminal justice interventions that are kind of the same way, like imprisonment. There's no RCTs on imprisonment because it would be unethical to change that intervention, randomly. But I think there are also a lot of interventions where people think they're ethical barriers to true experiments when there aren't. I think one example, Sarah, is sort of education provision in prison. And so in the past, we've relied on like a heavy body of correlational evidence because there's been this sort of supposition that like it would be unethical to hold some people back from education. I wonder if you could use that particular example to explain some of the dangers of relying on just correlational evidence to make decisions as a policymaker.
Sure, I'm happy to talk about that. So I think that in the case of recidivism rates, which is usually what people are talking about in that sphere of the sort of effects of higher education prison on post-release outcomes for criminal justice, you know, the most often quoted statistic that we hear is that people who go to college in prison are 40% less likely to recidivate than people who don't. And what we're really concerned about in that area is selection bias. There's a strong reason to believe that people who opt in to a higher education in prison program are different in how they might fare, you know, for one thing, just based on their motivation, their perseverance, their, you know, sort of stick-to-itiveness or get up and go, as compared to people who don't, right? So that's not an apples to apples comparison. We think it's pretty obvious that it's not. And what I'll say is that, you know, to your point, Richard, people will often say, well, it's unethical to withhold education from people. And I think there is some argument to be made for that in general, if, you know, the education programs that we're talking about are a gift. But in the case of some of the work that is ongoing, including my own study in Pennsylvania, the thing that's being randomly assigned because of the different capacity constraints in the prison for how many people can fit in a classroom at a given time, the thing that's being random assigned is access to a Pell Grant, right? And what's not obvious is that it is beneficial to someone to use their limited lifetime Pell eligibility, to the extent that people will still have that. But, you know, when things went into place, the idea was that, you know, anybody who was eligible for a Pell Grant would have a certain number of semesters of Pell that they would be eligible for. Now, if you're not incarcerated, Pell is a voucher program. If you're eligible for Pell, because of your income and the other requirements, you can use your Pell Grant to go to whatever university, you know, accepts Title IV funding, and study whatever it is you want. So if you'd like to study vocal performance at Juilliard, you can do that with your Pell Grant. That's not how it works in a prison. In a prison, you are constrained to whatever higher educational programming is available either at your prison or in your prison systems. In some systems, they do allow people to transfer to go to school. But you're talking about maybe an associate's degree in general studies. Sometimes it's a rehabilitation certificate, not even necessarily like a degree. And those Pell Grant semesters are not going to be available if they're used while someone's incarcerated. Now, might it be better? Yes. Is it obvious that it's better? No. Of course, educational providers want to believe that it's better. That's natural, and I don't think that's strange. But there's not evidence that it's better, right? There's not evidence that we're withholding a benefit necessarily. And I think that answers your question, does it?
Yeah, no, absolutely. You too, I think more than most academics work with policymakers. And so obviously, you know, a policymaker who is interested in making policy based on evidence, how do you communicate sort of that uncertainty and say, like, we have all these studies, they're correlational, we're working on something else, we hope it's better, you need to make decisions in the meantime. How do you sort of like create that warning label?
So it depends on the context. For example, there are some things where there's a lot of uncertainty. There's other things where there's a bunch of promising evidence with good internal validity and not a whole lot of external validity, meaning it works in some places. I'm pretty convinced it does. We don't know if it would work for you. That's exciting to talk about. For a researcher, if you've done research on a thing that shows promise and you think it can be expanded and replicated elsewhere, it's your responsibility to be cautious in your sales pitch. And it's really unnatural for academics to make sales pitches. They're awkward. We're awkward. But the idea that we have something that might work for y'all, you're worried about drunk driving. I have a way to control drunk driving I think might work. We'll have to adapt it because the evidence base that I know about doesn't look like your jurisdiction, doesn't look like the place where you want to solve the drunk driving problem. But I can tell you how it works. I can tell you what I believe based on the research so far are the core principles or tenets of this sort of intervention that I'm thinking of. And I can tell you the stuff that I think might matter and might be different for in the place you care about that you're trying to help versus the place where the evidence comes from. And I'm not going to get in the weeds unless there are some policymakers who want to talk about confidence intervals and the strength of like the causal assumptions of internal validity assumptions. Most don't. So I won't go there. But I will say, like, here's what I know so far. There are other types of policies or there are other types of policy problems where the evidence base is weaker. Like, how do we combat the opioid epidemic? We're seeing this big downturn in overdose deaths, but it's still 75,000 people lost their lives last year, right? It's down from 105. That's wonderful. Still an epic problem. Still a really pernicious problem. And we have no idea why we saw this large decline. We're hopeful that that decline will continue back towards zero for a long time. So one problem there is, like, we don't have a data infrastructure to study one of the biggest problems facing the United States. We don't have data to measure how extreme opioid overdose and opioid risk of overdose is from place to place. The only thing we measure well is once somebody's already dead. And so when we think about interventions, the first thing when we have a really pernicious problem is we need the infrastructure to measure an intervention. And it's really disappointing if we're measuring it using mortality, or if we're measuring the success of a criminal justice intervention using rearrest. That's fine because rearrest can occur more than once, mortality occurs once. But it's not as good as having some intermediate measures and that we can collect inexpensively and rapidly. And then when we have that stuff in place, and that's hard because it's potentially really expensive. I think measuring opioid misuse is actually a pretty low-hanging fruit. Just to get on a soapbox, we, like, through COVID, we're able to expand the use of wastewater drug testing, wastewater epidemiology to see, is COVID in this population. We can do the same thing for drug use. It's done in Europe, it's done in Australia. The methods are there, and we actually have the samplers that do all of the data collection, the specimen collection. We have that. We just would test it for other stuff. Like, we built out that infrastructure. So that's low-hanging fruit for policymakers if they want to see whether opioids exist in their community and the level of prevalence is changing. We have that ability. And now I've only told you about how to collect data. What could interventions be? Well, for opioid misuse and opioid use disorder, there's pretty good evidence around interventions related to the demand side, to people who consume those drugs. There's less evidence of successful interventions on the supply side. So if I were to say you've got a finite amount of resources for opioids, because they're so easy to produce, for fentanyl, there's so many analogs, I'd focus on interventions on the demand side right now. But that's just my 2 cents. If you were to ask me, like, do you have the same confidence about some intervention for opioid use disorder or for the opioid overdose crisis like you do, you're so confident about drunk driving? I'd say I really don't. I don't, but I can tell you, like, the body of evidence that exists points me toward these set of interventions rather than another set. And so depending on the level of confidence we have, given the body of work that exists, my message would be different to policymakers.
So just a footnote real fast. We're 10 minutes out from the end. Please don't save questions. Please add them to the chat if you have them. Sarah, go on.
I was just gonna sort of see if I could respond to some of Adam's questions. So thinking about, I mean, I think what you're asking about really are things like meta-analysis and systematic review and how to think about confidence intervals and you know, the pros and cons of model averaging when you have, you know, multiple studies on the same topic. And honestly, I think, I don't know if this is necessarily a hot take, but I'll just say I think that meta-analyses in social science should be is a real proceed with caution enterprise. I rarely think that they're appropriate, and that's usually because of concerns that I have about what I would call treatment heterogeneity, which is a largely unattended to problem. A lot of times researchers are very conscious and conscientious about treatment effect heterogeneity. They think, well, maybe different populations respond differently to this intervention, and we should look at that. Less so do we think about treatment heterogeneity, meaning that just because we have two interventions that are nominally called the same thing doesn't mean that they are the same. Doesn't mean that we can basically amalgamate the estimates and try to average over them, right? Even if we weight by sample size or try to think about weighting by rigor or whatever it is that we're doing, I think that it is a fraught enterprise because we really need to think about, what do we mean when we say, you know, in the case of my work, what do we mean when we say an educational program, vocational training? Like what was included? You know, were these similar programs? And I think that there are myriad examples that we could provide across other types of interventions, like problem solving courts or diversion programs or other sort of policing interventions and various things. Like, just because two things are nominally the same doesn't make them effectively the same. And that those differences are actually interesting to inform policy rather than things that we want to smooth over. So usually I would say that if we want to be generating summary evidence and we want to be systematic about it, like I would say I would strongly favor a systematic review approach or a scoping review approach rather than a meta-analytic approach where we're actually trying to sort of like quantify, like smooth over quantified estimates. You know, that tradition really came from the lab setting, where you literally could do the same experiment on a small number of people over and over and then combine to get more power. And I think it's rare that you can credibly do that in the social science, or like in the, not social science, but in the social experiment or like the sort of field experimental settings.
So my earlier question about how we should communicate with policymakers sort of presupposed that policymakers are actually picking up the phone and calling researchers, which is not necessarily the norm. I think, again, you two have been more influential than most social scientists among policymakers. How do you make those connections and get trust with policymakers and have them listen to what you want to tell them?
From my experience, and again, I think your flattery is maybe, I appreciate it, Richard. But there are public institutions, there are institutions that are meant to inform policy, that are meant to generate evidence. And universities, R1, Research One universities, that designation means that we're generating research that's supposed to help the world. There are research organizations who are trying to do like the highest possible quality policy informing objective research, like RAND. And those objectives require not just the good research to occur, but outreach. And again, sometimes there's a researcher who can do that well, but most of the time it's facilitated by some other structure in this Cannon Center. And researchers need to be willing to be a little bit uncomfortable presenting on things that they've been trained to be less confident about, right? That the idea that there's always mismeasurement, there's always uncertainty, we can understand that, but Sarah brought up the idea of compared to what. So if we have a big policy problem, or we have a big problem we think we can solve with the change in policy or some intervention, some new program, and we have some understanding about whether some programs might work better or worse, we should be able to explain that in a way that's compelling and useful to a policy audience. If we're only sitting in our offices and writing for our peer reviewers, then that's the wrong audience ultimately. It matters. We need to be able to do both, or else we don't get to keep our jobs. But ultimately, we're supposed to be communicating in such a way that it's useful for policy, not just for journal articles. And we rely on offices of external affairs or some acronym like that to facilitate that work, to match us with folks. And then once you've spoken to a few people before, you have a rapport, it gets a little easier, but expanding that network is difficult. And it takes a lot of time out of our day to do a good job of that too, but that's okay. That's part of the job. It's not an explicit part, but it's a really important part.
Yeah, I'll echo that, Richard, you're being too kind. Or sort of overstating our influence, but or at least mine. So, but I wanted to quickly respond to Stephanie's question. And I think it's related to some of what Greg was talking about, which is that like the Maryland scale that we were talking about earlier was designed to fit within the What Works framework on crime prevention. And this issue of treatment heterogeneity really fits more in terms of trying to identify what are the appropriate policy solutions and really attending to treatment heterogeneity when considering evidence about what is the path moving forward. The evidentiary scales that we were talking about earlier are really more designed to categorize evidence in terms of credibility for internal validity, but kind of presuming that we have treatment homogeneity, right? So I think that's a great point, is that basically it's incumbent on us to be organizing evidence, at a higher level before we would implement any type of evidentiary scale. But these are all important considerations that are somewhat, I think, and this goes back to our earlier, like the very earliest point, which is that given that there is a long legacy and tradition of these scales, and given that so much has developed in terms of our research capacity and innovation with research design, now is a good time to be sort of having these conversations again about how these things could be organized, what is important, and how things could be effectively communicated, so that the evidence production and the evidence consumption can be as aligned as possible and as useful as possible.
Final question also to Stephanie's point. So thankfully, thank you for Sarah for bringing us back to hierarchies of evidence. Fortunately, we mostly stuck to the very top of the hierarchy and the very bottom of the hierarchy. We didn't talk much about the middle ground, which is where it really gets complex. And maybe we can talk about that again sometime. But there are a whole lot of really cool research designs between a true experiment and a correlational study that people can use. Maybe just like one answer from each of you. What's a resource that an educated novice can go to start learning about the distinctions between different types of causal research?
So an educated consumer who's ready to think about it, there's a great public use or open license book called The Effect by Huntington Klein, I think is awesome. And Causal Inference, the mixtape is another great one that starts from an approachable undergrad level and gets through like really thoughtful explanations of credible research designs in this sort of applied economics setting. So those would be the two. Both I think can be downloaded for free.
Yeah, I would agree with that. I was going to bring up Causal Inference, the mixtape.
I third that recommendation. Okay, well, thank you everyone so much. Sorry for going over. Sarah, Greg, thanks for joining us. And again, a recording of this will be available on our website soon. Hope everyone has a great Thursday.
Thanks.
Thanks.